remain standing as Colleen Detmer sings our national anthem. Oh, say can you see on God's early rise was the world we beheld, and the twilight's last gleaming, whose the stripes and bright stars through the perilous light, o'er the ramparts we watched, words of gallantry streaming, and the rocket's red glare of bursting in air gave proof through the night that our flag was still there. Oh, the state of that star-spangled banner yet wave, for the land of the free and the home of the brave. Thank you, Colleen, and please be seated. I'd like to just, as your moderator, I'd like to just go through the agenda and then the rules of this forum. And we're going to have a 5 to 7 minute opening statements by both Congresswoman Bachmann and Dr. Burgess. Then there will be a question and answer by the audience from 3:05 approximately to 3:50. Then there will be closing remarks at the end by both speakers. And we plan on finishing the forum at 4 p.m. Let me go through the ground rules. Out of respect for all that want to see and hear the presentation, we ask that you not bring the signs in here, just so people can see what's going on. Thank you for all of you that left your signs outside. We want to ensure that no one's views are obscured. Similarly, out of respect for all attendants, we ask that you permit all speakers to speak and uninterrupted. That includes the people at the mics. The first rows are reserved for the press and media. Anyone who is here with the press or media, including the bloggers, please see Rachel Horn, the Congresswoman's Deputy Press Secretary, if you haven't already. She has a press packet for
Check.
you to sign and sign-in sheet. We only take questions and comments today on the subject of health care, on the health care reform. This is a health care forum. We have 2 microphones up front. When I call on you to present your question and comments, please state your name and the city where you live. Please keep your questions brief and to the issue on health care so that others will be able to get their chance to come up and speak. We ask that you please stay seated until both of the speakers have given their introductory remarks. Then what I'll do, I'll give you the signal that you can start lining up behind the microphones. To start off with, I'd like to introduce Congresswoman Michele Bachmann. Elected in 2006, Congresswoman Bachmann is the first Republican woman to be elected to the U.S. House of Representatives from Minnesota. On her first term as Congresswoman Bachmann developed a reputation as a principal reformer who stays true to her conservative beliefs while pushing real reform in the broken ways of Washington. And her strong advocacy for the constituents that earned her a second term. She has stuck by her words. She is leading advocate for bipartisan earmark reform and tax relief, and is a staunch opponent of wasteful government spending. Prior to serving in the United States Congress, Bachmann served in the U.S. State Senate. She was elected in the Minnesota State Senate in the year 2000. where she championed the taxpayers' Bill of Rights. And prior to that, Congresswoman Bachmann spent 5 years as a federal tax and litigation attorney, working on hundreds of civil and criminal cases. That experience solidifies Bachmann's strong support for the efforts of simplifying the tax code and reduce the tax burdens on the families and small businesses' budgets. Congresswoman Bachmann currently sits in the Financial Service Committee. This committee is tasked with oversight of numerous financial sectors, including housing, real estate, and banking. This also gives the Congresswoman keen insight into the housing crisis and the credit crunch, leading her to a staunch opponent to the taxpayer-funded bailout of Wall Street. The 6th Congressional District of Minnesota contains parts of 6 counties, stretching from Stillwater past St. Cloud, including suburbs of the Twin Cities, which encompasses many of the nation's largest financial service sectors, making Congresswoman Bachmann's position on the Financial Services Committee particularly important. Now, Congresswoman Bachmann also graduated from Minoka High School and Winona State University. Bachmann and her husband Marcus lives in Stillwater, where they own a small business and a mental health care practice that employs 42 people. The Bachmanns have 5 children, and they have opened their home to 23 foster children, which has inspired So welcome, Congresswoman Bachmann.
Well, thank you everyone for coming. I want to thank Bob Detmer for that great introduction, and thank you for your time, and also for Colleen Detmer for helping us to be able to open up with the national anthem. I want to thank those who are in the overflow area. We could not be more pleased with this turnout today. I think this speaks so highly of all of you who are here today, whether we agree or disagree. This speaks so highly of the people here in Minnesota, that you want to have a voice in this important debate that's engaging everyone across the country. So thank you so much for taking your time to come today, and I understand we have people in the overflow area, in the cafeteria. I'm sorry that we couldn't break open the walls and let you be a part of this, but thank you for your patience. I know it's a little trying to watch this on a remote. We're thankful you can actually watch this out in the cafeteria, and we're thankful you can hear. If for any reason, if the sound goes down or the video goes down, please let someone know so we can make sure that you can remain a part of this forum as well. We're also videotaping this, and we'll try and make this available on the web so we can get this broader distribution for people as well. So thank you again for coming. It is probably, one of my relatives says that Minnesota has about 6 perfect days a year, and this is undoubtedly one of those perfect days. So the fact that you would choose to be here in Oakland Junior High today is really remarkable. Thank you for coming. I know you struggled with parking, and so thank you. I'm assured that no tow truck is going to move those cars out there on 15 on Manning. So we are very grateful to have all of you here today. So thank you very much. You could also be at the State Fair right now ordering a Pronto Pop, and probably some of you are planning to go there. My husband says, hey, it's the cleanest day of the fair, we've got to get out there. So you might see us out there. I don't know if our kids made it to the forum. They're probably at the fair right now. So thanks so much. We've had a great summer. I mean, we were able to bring Brett Favre in to wear his number 4 jersey here for the Vikings. That's a great summer down payment. Uh-oh, maybe I opened up a can of worms. But we got Brett Favre here, and we had the PGA here, which was extremely exciting. We had Tiger Woods, and there was a rumor that this weekend... Well, we're going to talk about healthcare. But there was a rumor that President Obama was going to have Tiger Woods play a round of golf with him on Martha's Vineyard this week when he was on vacation. And I don't think there's any truth to that rumor, but we had also heard that the President may try and hit him up for a $300 trillion loan, which maybe we could use about now here in our economy. So anyway, we're very grateful that all of you are here. So thank you for that. As we're looking at the context of the debate today, one thing that we're looking at is the fact that, and hopefully we can work work that out. We do want to have reform in healthcare. There's total unanimity. There is total agreement. I don't know anyone, and Dr. Burgess, who's joining me here on the dais today, I don't know of anyone in Congress who wants the status quo. We want reform, and we want to change the way that Washington does business on healthcare, and I believe we're going to get it. Because all of you are asking for a new way to do it, but the question is, what kind of reform will it be, and will it be one that we can live with in the long term? We have to have it. But the question is, will we go down a road where all of you have more control over your health care, more decision-making authority, where we can actually reduce costs, or will we take a road where government has more authority over our health care, and government has the say over our health care decisions, and one where we lose the authority over costs, but government picks up that authority? That's really the crux of where this debate begins. And that's why we're so anxious to hear your opinions. Again, pro or con, we want to be able to be here to hear your opinions, and a robust debate has been taking place across the country, and thank goodness the 6th District is no different. You want to be heard as well. So before we discuss the different paths that are available to us, I just want to lay a little bit of context about where we are right now financially in the country, because healthcare is smack in the middle of our financial system that we're currently dealing with. And the President has said quite clearly, and I believe him at his word, that he wants to have health care reform because he wants to control costs. And again, I think that is unanimous agreement. We want to control costs. There's a difference in how we approach it, and a difference about what we believe will control costs and what will control costs. But we are at a truly perilous time economically in America. The policy chair of the National Center for Policy Analysis is a gentleman named Mike Whalen. And Mike Whalen wrote that the United States is functionally bankrupt. And he says that we are, even before we consider this multi-trillion-dollar health care bill that is currently before the House. It's known as H.R. 3200. Tuesday, you probably saw in the news that the White House released the updated budget numbers, and they read kind of like a Stephen King novel. They're very scary, the budget numbers, because the administration is projecting a deficit this year of $1.6 trillion. That's a lot of money, that level of deficit. Just earlier this year, the White House predicted we would be $7 trillion in debt in the next 10 years. Well, just consider, between the first part of the year and today, now the Congressional Budget Office is estimating a $9 trillion deficit, potentially 10. That's a tremendous increase in debt level. And we have, I believe, this out, if you picked up some of the literature that we have on the tables, this is, sometimes we can get confused when we hear the terms million, billion, trillion. What does that mean? Well, let's just take an example. A million seconds is 11 and a half days. A billion seconds is 32 years. A trillion seconds is 32,000 years. There's a big difference between billions and trillions. And when our country continues to spend money with no thought as to how we're going to pay for it, it's the 19 and 20-year-olds in our society that are going to be saddled with that debt. The borrowing costs, the spending costs, the taxing costs. We have to consider that generation. And if you took a tightly stacked $100 bill tax, that if they totaled $1 million, it would be about 4 feet high. But if you had $1 billion, that would be 4,000 feet high, or equivalent to 3 Sears towers stacked on top of each other. That means if you had $100 bills that total $1 trillion, it would be 789 miles high, or 144 Mount Everest stacked on top of one another. So these numbers add up. That's the point. They add up and they mean something. And so as we look at the context of healthcare, we have to consider the cost. Because we also have another document out there that I want you to take a look at. Government has always grossly underestimated the cost of the programs that it puts into place. And this is healthcare costs. Historical understatements highlight the unreliability of projected costs. Medicare was passed in 1965, and Congress estimated that Medicare would cost $9 billion in 1990. It actually cost $65 billion. And with all of the changes in Medicare, the ratios of government underestimating the cost are about 7 to 1. So we have a historical analysis where government has time, they've never overestimated the cost, they've always grossly underestimated the cost. There was a study that was done in the late 1980s, and it showed, for instance, with Social Security, the kids that were born in 1987, who are today about 22 years old, those kids, when they get into their prime earning years, could be looking at about 25% of their paycheck going to pay just for Social Security. Medicare costs a lot more than Social Security, so that would be at least 50% of their paycheck. That doesn't include federal income tax. If you include federal income tax of about 30%, now that 22-year-old is up to 80% tax rate. Then you have to include your state taxes. In Minnesota, maybe that's 8%. That'd be 88%. That doesn't include property taxes, sales taxes, gas taxes. We cannot do that to the generation that's coming up, to spend money without thinking about how it's going to be paid for. So I lay that context down as we talk about the future of healthcare, what we're going to have and what we're going to pay for it. One option is to have the government take it over and pay for healthcare and create a new program. Here's another option that hasn't been talked about very much. And that's the option where you own your health care, not government, not a business. You own your This is a direction that I think that we should put into the debate mix to talk about. Because this is something that won't add to the government debt substantially the way that the option does on H.R. 3200 in the House. If people can own their own health care, here's a couple of things we can do. And we can go forward again and talk about this further because, again, we want to get to your question. We can do this. There's a law right now at the federal level that says that states can, in effect, draw boundaries around their state, and insurance companies don't have to compete with other companies outside of their state. This jacks the cost of health care way higher than what it would need to be. If we took a big eraser and erased those lines at each state's boundary and allowed people to buy health care anywhere in the United States, in other words, if we allowed more competition among insurance companies rather than less competition, we would see more insurance products at cheaper prices and people could buy what they want, the level of health insurance they want to buy. Something else we can do that currently isn't being done, we can allow for associated health care plans. Where, let's say, realtors, for instance, who are in essence are self-employed, realtors could all band together like a credit union does, and they could pool together and use that purchasing power to purchase a health insurance policy and again bring the cost down for their members. If they want a high deductible, then we can offer people tax-free savings accounts. So if you have a high deductible, let's say, you'd have a tax-free account, you put your own money in that account, you can draw your own money out, you can pay for your high deductible, but also you can pay your co-pays. You can pay going to the dentist. You can pay going to the eye doctor, getting a hearing aid. In other words, giving you the power. Think of it as like a backpack that you would put on. And it's your health care, and you make the decision about how much you want. Not some bureaucrat. You make the decision about how much you want. The very first bill that I introduced when I went to Congress was the Health Care Freedom of Choice Act. This idea has been around a long time, and I think it merits favor, because what we want to do is level the playing field in the tax code. We want people to be able to have the same advantage to buy their own health insurance that businesses have. Businesses can fully deduct the cost of health care, but individuals can't. I believe you should have the right to fully deduct your health insurance premiums, your co-pays, your deductible, whether you go to the dentist or the eye doctor or get a hearing aid, you should be able to deduct that on your income tax. And I think we can make health care affordable for the vast bulk of people. Not everyone will ever be able to buy health care. There will always be a cohort of people, through no fault of their own, who just can't. They're profoundly disabled. They have extraordinary medical conditions. We are a compassionate society. We will always have that safety net. We have to, for people who need that. But let's not destroy what truly is the greatest healthcare system the world has ever known in but I will hand this over to Dr. Mike Burgess, and I want you to know, Dr. Burgess has been a member of Congress since 2003. He's been a great fighter, and he's been bringing together Republicans and Democrats on true health care debate and reform. He's a great bipartisan leader, and best of all, Dr. Burgess was born in Minnesota at the Mayo Clinic where his father was a physician. We're just trying to figure out why he ever left. But he's a representative of Congress representing the Dallas-Fort Worth area from Texas's 26th district. Please give him a warm welcome, Dr. Burgess.
I'll be very brief. Let me just set the context here. I do get questioned a lot of times as to whether I should be called doctor or congressman. If there are any doctors in the audience, you know we have about a 78% popularity level. Of course, members of Congress are down. So mother always called me doctor, and that still works for me. In the interest of full disclosure, I've spent the last year really intimately involved with this. First, as an advisor to Senator McCain, and then a surrogate on the McCain campaign. I got to know Senator McCain's health proposal pretty well, became very facile with discussing it. Might even be argued I knew it better than he did. In fact, if he'd let me do that last debate, who knows? But I also got to know President Obama's surrogates, and I got to know his health care proposals fairly well as well. And I feel as if I ended the presidential campaign with uniquely situated, if you will, knowing pretty much both sides of the argument. Now, I will tell you, Max Baucus, right at the end of October last year, chairman of the Senate Finance Committee, convened a group of stakeholders. You know, there's stakeholders if they're on your side, there's special interests if they're on the others. But he got a group of stakeholders together over at the Library of Congress, produced a white paper, and I thought for all the world that was the bill that we were going to see. Because President Obama won the election in November, he was inaugurated in January with the highest popularity that any president has ever had coming into office. And I naturally assumed, based on what I had heard during the fall, that President Obama's program would quickly be before us in Congress. So I was startled, to say the least, that we did not see that in February. We spent a lot of political capital, or someone spent a lot of political capital on the stimulus bill. We worked on some other things through the spring. We did cap and trade in the early summer, which had some negative connotations for some other people. And then as a consequence, when we got down to health care in July, it became much more problematic. In a way, that's a good thing, because this summer, just as Michele has demonstrated for us today, participatory democracy is alive and well and works in America. And for that, I am very grateful, regardless of where anyone stands on this issue. The fact that we slowed it down, that I say we, This was not a Republican effort to slow it down. This was actually internal arguments within the Democratic Party. The Republicans don't have the numbers, really, to do much of anything as far as if Nancy Pelosi wants to pass this bill, it's passed through the House, just as she did with cap and trade. But it did slow down. And as a consequence of slowing down, people have had an opportunity to look at it in a great deal more detail than otherwise would have been possible had we rushed it through on the 1st of August, as was the intention. Now, we'll get back to Washington in September, the week after Labor Day. It's anyone's guess as to what happens on the House side. A lot is going to depend on what members of my party, what members of the Democratic Party have heard from their constituents back home. Will there be the institutional courage to pass H.R. 3200 as written, or will there be changes? Will we go back to the drawing board and try to make some real improvements on the bill? I don't know the answer to that. We passed the bill out of our committee July 31st, which was the last day we were up in Washington. It was relatively late in the evening, so I don't know if many of you were watching. For the record, I did vote against it, so I can say that unless it changes substantially, you can expect the same vote out of me when we convene in September. However, the chairman of the chairman of my committee, Henry Waxman, we don't always see eye to eye on things, but the chairman committed to coming back and having one more day to consider some of the amendments that were left on the desk. And we did have a lot of amendments left on the desk. So we will come back and consider additional amendments. How those get wrapped into the final bill, I don't know, because that's sort of a different and new process. All three committees that considered this bill on the House side, this product will have to be condensed and put into a single product. It will have to be rescored by the Congressional Budget Office, and then we've got to wait on what the Senate does. And the Senate has taken a little bit more bipartisan approach to this, but remember, it was almost a year ago that Max Baucus produced this white paper, and they still had not got a bill to bring before their committee to go through a markup. So at some point, does the White House put pressure on Max Baucus? Does Max Baucus give in to the three Republicans who he's still talking to in the Senate? I don't know. I don't know. It remains to be seen. We can talk about reconciliation during the Q&A if someone has an interest in that, but that's another issue that's out there. And ultimately, the president said he wants to sign this bill his first year of his first term. I don't know whether that's practically possible or not. I would never have believed that we would have gone home in August without having a floor vote. I thought that was a foregone conclusion. I really thought we would see a bill in February or March when the president's popularity was still sky high. Some of that popularity has dwindled over the past several months, so we'll have to see. In any case, I'm very happy to be here with you today. I appreciate so much the involvement, and again, participatory democracy alive and well in America, and that's fundamentally a good thing. Thank you very much.
Thank you, Dr. Burgess. And before we start with the QA, the question and answers, I do have two questions from the overflow room, and being that they weren't allowed to get in here, I'd like to first have these two questions. So would you please stay seated until I give the okay to, there we go, give the okay to come forward to the mics. This question is asked by John Ebermeister from St. Cloud, Minnesota. What will happen to Medicare Advantage plans under proposed legislation? Will these change?
Does my microphone work? Does my microphone work and can you hear me? Okay, great. Let us know if you can't hear us at any time. Don't be afraid. Don't be shy, and I trust that you won't be. The Medicare Advantage program is something that the President has said repeatedly that he's hoping to see end. And it appears from, again, there's one bill in the House that has been changed in 3 different committees, and all those changes have to be reconciled. There's another bill in the Senate that's still kind of in an embryonic stage, so we don't know what the final bill will be. We know the President has said he wants to eliminate Medicare Advantage, and we assume that ultimately Medicare Advantage will be out, although numerous senior citizens across the country appreciate the program. It's actually reduced in a great number of savings, but it appears that's what the President's goal is, and I would assume that's probably what we'll see. And perhaps Dr. Burgess has something he'd like to add.
On the, is this microphone working okay? Talk louder. On the, during the presidential debates last fall, Medicare Advantage was the one thing that was consistently singled out by President Obama as a federal program that he would cut. It's listed in the Congressional Budget Office for as $170 billion in savings over the 10-year budget window that they were looking at on this bill. So I don't know, but it does look as if Medicare Advantage will be significantly structurally changed. Now, you do also hear a lot of talk about places like the Mayo Clinic, places like Geisinger Clinic. You hear a lot of talk about developing that type of care model, a so-called accountable care model that would deliver more care for less money. I was at a roundtable in December on just this topic with accountable care organizations, and I was somewhat surprised because 4 of these major multi-specialty clinics in the country that are participating in this study said without Medicare Advantage, it would be very difficult for us to deliver the kind of results that you're asking us to deliver. So, the things like care coordination, medical home, disease management, all of those things that we talk about, both sides, talk about as measures to save money in the Medicare system, those may be put at risk if we significantly cut Medicare Advantage. So, the President also said last fall that he wanted to be careful and do cuts with a scalpel, not a chainsaw. I think this is one where they may want to be careful because there may be more information than they have had than they've had available to them, because they need to talk to some of these groups that are actually doing the kind of work we've asked them to do in these accountable care organizations to deliver more care to more senior citizens at a lower cost. But we'll have to see where that goes.
Okay. The next question comes from the southern part of our congressional district, from Stillwater, Mr. John Baer. He asks, this is directed to Dr. Burgess. As a doctor, have you ever canceled someone who came to you with questions regarding a health care directive? Do you feel that such voluntary counseling should be considered as a death panel?
On the the pictures, page 425 through 435 in the bill, the concept was very simple. As a physician, I think it was a good idea. Let's pay the doctor for doing the education. Now, unfortunately, that very simple idea has now translated to 10 pages of legislative language. So it's no great surprise that people are concerned about what is contained within there, and the language does tend to be pretty prescriptive. There is also the issue of the comparative effectiveness boards that are not in this bill. They were passed in the stimulus bill last February. So when you marry the language that you find in this bill with comparative effectiveness boards, and you include the increase in the availability of information online, the electronic medical records, which was also part of the stimulus bill, at some point the grand plan is to have a server that's going to have everyone's medical information on that. When you marry those 3 concepts, it does cause people to be nervous, and I understand why people are. To me, the more troublesome language in this bill was the section immediately following the advanced directive section, where it said that physician quality will be measured on the number of people who sign up for advanced directives. It tells me that we're going in a direction that is not the direction that I would recommend we take. I think it's perfectly sane and sensible to have the doctor have a conversation with the patient about advanced directives at the time of initiation of Medicare. The Welcome to Medicare physical seemed like an appropriate place to do that. I thought we ought to pay the doctor for that, because some people in Congress were so worried that doctors would game the system and submit that charge every time they saw a Medicare patient. They said, we're only going to pay for it every 5 years. That's where the 5-year interval came in, and then the other language in the bill, unfortunately, rather than being comforting, was discomforting to more and more people who read it. And again, that's one of the reasons why it was a good thing to have the bill out for people to scrutinize and look at.
I think, if I could just add to that, I think promising to cut costs by having a panel of Washington bureaucrats make the decision about what type of medical treatment people are going to have hasn't proved to be a real popular idea across the United States. And I think that's where a lot of this has come in. Again, it goes back to the central crux. Who's going to make the decision over your medical care? Will it be you, or will it be a nameless, faceless bureaucrat? And I just want to direct your attention to the board that's up here on the stage. We may have copies of this for you to take. The bill that's in the House, H.R. 3200, creates 53 new bureaucracies. It's a full employment act for bureaucrats. And so just consider, put yourself, your children, your elderly parents on one side of that board, put your doctor on the other side of the board, and just recognize you have to go through these 53 new bureaucracies to connect yourself and your people to the doctor. So it's very concerning, and I think that's why you see people all across the country saying, I'm not real comfortable with this. And I think that's why people have a right to ask questions. You ask questions now before the bill is passed, not later, afterwards, because Washington is doing a lot right now, saying, trust me. Just trust me. The American people are saying, we don't trust you.
Okay, I just want to remind everybody that when I give you the direction to go ahead and line up, that you keep your state your name and where you're from, what city you represent, and keep the issue to health care. And just another reminder, you know, I wrestled and coached for a total of 45 years, so be careful. We'll keep this so that everybody gets a chance. And by the way, I'm going to extend it to 4:15. Okay? And the young lady to my left, your right, was, I think, at the microphone first, so we'll start on the left, then we'll go to the right, and so forth. Okay.
Thank you. I'm Christine Norton from Cottage Grove. Congresswoman Bachmann, I share your concern about the costs of medical care. I'd like to know how you feel about evidence-based medicine, and you've already somewhat said about comparative effectiveness research. My understanding of those boards and looking at the composition of them is that it would not all be bureaucrats. There would be medical people on there. There actually is consumer representation, which is another concern of mine, to have consumer representation on any boards, panels, or commissions that are developed through this legislation. I believe that evidence-based medicine, shared decision-making, and comparative effectiveness research will help us to control over-treatment and some of the high costs of medical care. Thank you.
That's a great question that you're asking. And I would agree with you that I believe that we will see medical people, consumer representatives that are on the board, and evidence-based medicine is not a bad thing to look at, because we want to make sure that we are incorporating best practices. But I have to go back to my initial premise. Who's making that decision? If you have more competition with more insurance companies, and you have individuals contracting with insurance companies over what they want to purchase, you can have those companies looking at controlling costs through the best practices. The problem is when you have the comparative effectiveness in this type of an arrangement like what we see with the federal government, you have people that are removed from the people, because you take away the sovereign choice of the consumer. Under this plan, there is no out. Government says this is the plan that you have to go with. Whether government tells private insurance companies they have to follow this model, or whether it's a government plan, it's still government calling the tune. I like the idea of the consumer calling the tune. That the consumer says what they want to have in a health insurance plan that they get. So I'm nothing against any of those that way of looking at medicine through the Comparative Effectiveness Council. But the thing is, what does a person do if they're in a one-size-fits-all system and the decision comes down, sorry Charlie, you're out? Where does the consumer go to get the health care they need? And I think all of us agree we want people that have access to health care, and I just don't think this is the best option. So Christine, thank you.
Okay, Mike on the right.
Congresswoman Bachmann, I'm just grateful that I'm here and have an opportunity to speak with you. I live in Blaine. My name is Trent.
Why don't you speak in the mic? Speak in the mic.
Can you hear me now?
Better. Make sure you use the mic.
Okay. I'm from Blaine, Minnesota. I actually went to Lincoln Elementary School, Anoka, Fred Moore Junior High, and Anoka High School. So I'm a graduate of Anoka. I've been a public school teacher at Soderberg Elementary School in the Anoka District for 20 years. I'm a 4th grade teacher. I'm very passionate about my job. I'm grateful that I have the insurance that I do. I don't take it for granted. I'm just very appreciative, and I don't take my job for granted either. You know, I'm not a racist. I'm not a right-wing extremist, yet I have conservative Christian values. And again, I'm just, you know, your run-of-the-mill middle-class type guy. But here's my question, and I'm sure some people will say, geez, this guy's a nut, he's this, he's that, and I'm not. My concern is after this 4 years with the current administration, or possibly a second term of 8 years, I have concerns that, to be frank, that they may not leave the White House. I believe that they, whether by force, brute force, I knew I would hear this, or just by a fraudulent but I tie this into freedom, because with this health care program goes our very freedom, and if people can't see that, then I'm sorry. But, so my concern is, and you may not be able to answer this now, and I understand, but just to think about it, just about the danger of, quite honestly, this administration not leaving power.
I think I got your question. Thank you. Thank you for coming out today. Thank you for being As a fellow Anoka grad, I think I'm a lot older than you are. I'm class of 74, but thank you for what you do as a teacher. That is my concern too, freedom. Number one, that's what this country is founded on, is freedom. And I'm very concerned about the federal government coming in and taking over 18% of the private economy. Because an economist from Arizona State University had an article just a couple of weeks ago that said this: since the inception of Bailout Nation last fall, September, October, since the inception of Bailout Nation, absolutely, okay, I don't disagree with you. This was under George Bush, and I voted against the bill because I don't agree with the $700 billion bailout. So this is a bipartisan effort in terms of Bailout Nation, and I oppose Bailout Nation. Since the inception of Bailout Nation, we have seen 30% of private business profits today owned or controlled by the federal government. If we go down this road and have the federal government take over another 18% of the private economy, just realize we're looking at 48% of private business profits owned and controlled by the federal government. That's not the direction that's going to lead us to opportunity and growth and prosperity. And that's my concern.
Yes, thank you very much. My name is Mike Robinson. I'm from Stillwater, and I would like to go back to your assertion that we have the best health care in the world. I believe that the 18% that you mentioned is 4, 5, or 6% above the industrialized nation's percentage of GDP that they spend, and from many measures, including life expectancy, we have worse outcomes. We're more highly medicated. More illness, and I think the use of the term health care is a misnomer. This is illness management. We're paying much too much for our illness management. We need to cut the costs and get back to some good health care, including bike trails. Okay, that's my health care program. Thank you very much.
The difference is, I want to make sure, Mike, that you have the opportunity to buy the type of health care that you want. If you don't want the illness management in the way that it's currently done, I want you to have that opportunity. For instance, Some people do well by acupuncture. Some people do well by alternative forms of medicine.
Your
I want
assertion of the best health care, you're not addressing the
Okay.
question. Your
Okay,
assertion
so-
of best health care is not being addressed.
Okay, Mike said that he wants me to address the issue of the best health care in the world. You and I disagree. I believe we have the best health care in the world. I believe that we should each be able to purchase the type and quantity of health care that we want. No matter what type of health care it is, I want every possible option available. So we can disagree about what the best is, but I'll tell you what, I would far prefer to have American medical care than I would health care in the UK any day of the week. One final point before I let Dr. Burgess make his point. I just printed out before I came. These are just some headlines from the UK, the United Kingdom. This is just half of the stat. Headlines about the disaster that is the government takeover of healthcare in the UK. You probably heard about the story day before yesterday. It says the babies are being born in hospital corridors. There's a bed shortage that's forced 4,000 mothers in the UK to give birth to elevators, offices, not here. And I'll tell you what, I've given birth here probably more times than you, sir. I've given birth. I've given birth to the Stillwater Hospital, and I'll tell you, it is the finest care you could ever receive. And I
I've had the opportunity to work with multiple academic medical centers around the country. You see people coming from all over the world, to come to our centers, our Mayo Clinic, our MD Anderson, our Southwestern Medical School. People in this country going to France and England to get their medical care. And I would just also add, America is so fortunate to have such a large number of dedicated men and women who are willing to put their lives on the line while we debate the relative value of their efforts. They still show up for work every single day, and we need to be mindful of the fact that our words have consequences in their lives as well. So for any of you doctors and nurses out there, thank you for the job that you do.
Mike, am I right?
Yes, Jane Stewart from Baytown, and I just like the audience, I have my grandchildren here, and they said they get an offense for the behavior here in elementary school, and you know, I want them to see what democracy is like. I was in a middle school many years ago, and there was a sign up on the wall, and it was the sign Voltaire, and it said, I may not agree with what you say, but I will defend until death the right for you to say it. And I think we have the most wonderful country in the world, and my husband and my son were in the Marine Corps, and they told me, even if people don't agree with you, we fought for your right to speak. And I would just ask that you're all respectful. I respect people that don't agree with me, and I'd like to hear what she has to say about all this. It's very interesting, and I'd like to have a good example for my grandson. Thank you.
Microphone on my left.
Hi, Michelle. Number one, you're my hero. I love you. Because I have it in me as well. I want you to know I don't like to have my health care that I have right now. 3 weeks ago, I had surgery done in my knee. And had I been under Obama's plan, how long would I have had to wait to have two torn cartilages to be repaired and a bone burr that was as large as a marble? How long would I have had to wait to get that taken care of if I had been under Obama's? My question to you is this. What if the people that you're talking about to get under a health care, how are you going to go about getting those people to sign up if they don't want it? And those people that are not on it right now are probably getting it free. And they probably want to stay on it for free. And I'd like to know who wrote the bill, who wrote the amendment for us to go on universal health care, and if we're supposed to be all included in it, are they included in on it? I want to know that.
A lot of great questions, and we'll try to answer them. There was an amendment offered in committee, and Dr. Burgess sits on the Energy and Commerce Committee, but there was an amendment offered in committee that said, if this health care bill is good enough for the American people, it should be good enough for members of Congress to go in and that assertion that we should not subject the American people to anything that we aren't willing to subject ourselves and our families to. And unfortunately, that amendment went down in flames, which tells me something, tells the American people something, that there is perhaps something not to be liked in this bill, and we need to think this through very carefully. And I think you had something.
Yeah, that particular amendment in Energy and Commerce was actually struck down on technicality by the majority. They said we didn't have jurisdiction to consider benefits for the House of Representatives, the administration, through our committee. If we don't, I don't know who does, because that's all we do. But it was silly to see it struck down. That nobody wanted to be recorded on, nobody wanted to be recorded as having voted against that amendment, so they knocked it down.
And as to how long it will take you to get the procedure that you just received, none of us know, because again, it would be up to the people that serve on these boards who would make that decision about how long it will be. We don't know. That's been part of the horror stories that we've heard about in countries where someone other than yourself makes those decisions. That's why we're hearing the debate about rationing. No one wants to see rationing, and one argument that comes out is, well, your health insurance company rations your health care. And that's a viable argument that people can make, but again, I want to have more competition with more health insurance companies. In other words, think in your mind of how you have the freedom of buying your own car insurance. I want to make sure that health care can be like that, where you can go out and purchase your own health insurance the same way you purchase car insurance. Then you decide that level of care, and if you don't like that insurance company, you walk and go to somebody better who offers exactly what you want. Again, you make the
Michelle, my name is Wayne Johnson. I live in Ham Lake. I'm a Navy veteran, and as a matter of fact, I was involved in the failed rescue attempt for our hostages in Iran. I would, all of us here want, I think, the same thing. We want good, strong health care. And I believe, as you do, that we have that right now. I was injured in a car accident after the Navy. My injury is not as a result of my service. And I would not be alive today were it not for our medical coverage in this society. And more than that, I didn't have disability insurance, that sort of thing. And so the values that we all share, the values that brought us all here today, is what has allowed me to go back into the workforce, help me go back through school, all of that. We have the greatest country in the world, right here. I sincerely and wholeheartly am very grateful that you are representing us, because you represent my values. And my question is this then. I worked as an actuary for one of the local companies here in the early 1990s that was one of the only providers of medical malpractice insurance. And where is the tort reform? I suspect we all know why there is no tort reform in the current Democrat bill, because of course lawyers are malpractice, medical malpractice is a very profitable business. But my point is, where is the tort reform? And I guess I'll leave it at that. But just one last thought is that when you have, in insurance, mine was property casualty, but everyone is insured. There's an old saying, everyone is insured. We are either self-insured or we buy insurance. It is simply a transfer of risk. Our health insurance is not true insurance in that it is a healthcare service provided. I do not want the government telling me, getting in between me and my doctor, and I've had to deal with healthcare a lot in my life. So I'm going on too long, I apologize. So where is the tort reform? That's my question.
I know Dr. Burgess wants to add to this too, but let me just say a couple things quick. Thank you for your service to our country, and we want to make sure that we continue to provide for you and that all Americans enjoy the best health care that we possibly can have. We're here at Oakland Junior High today in Lake Elmo, Minnesota, where we are literally in the shadow of 3M and also not too far away over just north of us on Highway 10 up by 35W, Medtronic. And if you take a look at the innovation that has occurred right here in Minnesota, a doctor-owned hospital down in Rochester, Minnesota, started by Charlie Mayo and his brothers. That is true medical innovation. We see some of the greatest, finest teaching done at the University of Minnesota hospitals. The tremendous breakthroughs that's occurred in heart medicine, for instance, at Minnesota. But just think, there's a gentleman who was tinkering in his garage in his backyard, and he came up with something called the pacemaker here in Minnesota, which turned into Medtronic Company. 3M, the tremendous products that they have innovated and developed that have added to our quality of life in terms of health care. All of this innovation has helped your quality of life, has helped ours. That we don't want to see stifled. When government takes over that 18% of the economy, we know that there will be a stifling on innovation, new products, new drugs, new procedures, new medical devices. That's not where we want to go. We want to encourage the future because so many of these breakthroughs, not all certainly, but many of these have occurred right here in the United States. We do have the finest trained doctors in the world in the United States, the finest trained nurses in the world in the United States, the finest hospitals in the world in the United States. Why do you think that medical professionals want to come here in order to be able to practice and receive their training? Because we're the best. That's why we want to keep it going. And to answer your question on tort reform, you're right about tort reform, which is medical malpractice reform. I hold up for you, this is Dr. Burgess's dog-eared copy. Both of us have spent a lot of time reading H.R. 3200. Isn't it interesting that in 1,018 pages, they weren't able to put one line about tort reform in this bill? There isn't anything for medical malpractice reform. That would go a long way toward bringing down the cost of health care, and I think it should be in there. Surgery is. No bureaucrat could override your doctor's decision. That amendment, again, went down in flames in committee, which is, again, the American people are very smart. They're watching what's happening, and when they see these amendments go down, they have the right to be nervous about what's happening in Washington. Dr. Burgess.
I put two amendments in for tort reform in this bill. One was struck down on a technicality. The other was defeated on a party line vote. It's going to be very, very difficult. We're going to ask our doctors to be our partners with us at the level of the federal government, this public option, but we're not willing to give them the very basic amount of protection that they're asking for. So that was, the gentleman's right. It's a very big shortcoming in this bill.
Okay, thank you. The gentleman on my left. Dr. Veronica May Township, and I want to thank
Can you talk in the mic?
Dr. Ilya Veronica, and I live in May Township. I would first like to thank you, Representative Bachmann, for turning a Reagan voter into a JFL activist. Thanks to you. And my question to you is this. Why do you persist on restoring the president's plan to be supported? Why
on stretching the truth to the point of lies, so that an independent, not a liberal, but an independent panel on CNN, on St. and 3 cancer violations and 0 proofs when it comes to healthcare. Thank you.
I appreciate you being here. And I frankly found it quite stunning when the president has made his assertions about health care, saying this isn't a government takeover of health care, when the public option that has been described, and when you read 3200, all you need to do is go to page 19 and find out this. Find out that once this bill takes effect, you can no longer purchase a new private insurance policy outside of the existing system. In other words, everything comes to a screeching halt and everything turns into the public option. That's why people are very concerned. And so, is there misinformation out there? Yes. But it's stunning to me when the president has made remarks such as the AARP endorses his bill.
And that's not true. That's not true. And you got 6 lines.
That's why we need to have more debate on this issue.
Honest debate.
And that's why I'm so thankful that you came today. I'm so thankful that you came today. Those who agree, those who disagree, I'm glad that we're all here because we need to find out not what we think is in this bill, but what's actually in this bill. Washington, D.C. is telling the American people, trust us. Trust us. I think we've been there, done that. Now we want to have food on the table.
I'm sure the president would have done a lot better had he introduced his proposal rather than been up there defending the proposal of Mr. Waxman, Mr. Miller, and Mr. Stark.
By the way, I know I'm the moderator, but as an educator for 34 years, I wouldn't allow that T-shirt in my school. You saw his T-shirt. Okay, yes. My name is Emmanuel Zapata. Figuratively speaking, that is. What my name is Leroy T. Schaefer. I'm a city councilman from St. Francis, so I'm sort of, in a way, in a very small way, an insider. And I'll tell you, she's right. We got the best health care in the world. The very best! Clap too soon. That's if you can afford it. You can't tell me that bringing $300 million to a large pool wouldn't have immediate crop. And I'll be damned if I'm going to give up my Social Security because it's socialism. I'm not going to give up my Medicare because it's socialism. It has been proven time and time again that the government in some things has to have the fingers on the pulse. Where competition is needed in the marketplace. But I'm a lawyer who's going to say very poignantly, you know what? Why don't we have the Fortune 500 corporation heads run this government? Because with all the loving they do, they are anyway, it seems like. Now that's so much the truth. It's scary. That's not a whole concern when you want to listen to us, believe me. But I'll tell you one thing else. As a politician, I know this. We work on your figures. I don't. I'm too small. I can put it for my own campaign. You look at your internet and find out where these guys get their money. And I'll show you on the internet where they vote most of the time. So you need a question. One of the questions is that, do you think the lobbyists and the money interests in that are actually running this government? Michele Bachmann. You can agree or disagree. It all depends on who you believe, guys. You can believe me, you can believe them. That's what it boils down to. You know, they have the right to say what they gotta say. And I appreciate you letting me give this emotional, speech here because it's necessary. A lot of us, six-pack Joe,
Thank you for your question. I appreciate it, and you're probably the best person here in the auditorium today, so congratulations. But your question is about the lobbyists and do they run the government. The 535 members of Congress that have election certificates cast their votes, as well as the President of the United States who is elected by the people. We're the ones who make the decisions, but there is a lot of truth in what you said about the influence of special interests behind those votes. And I think people need to follow the money, as you said, and find out where it comes from. And the lobbyists are crawling all over Washington, D.C. right now. And you can take that to the bank.
I just want to make one more comment on that. I think we should have started calling, don't be a government. Don't be a government. Okay, here we go. Let's continue on. We've got plenty of people with questions on my left.
Hello, my name is Irene Boone, and I'm from Stillwater, Minnesota. And Michele Bachmann, you are not my hero. I've watched you not. You have done very little that ever represented the community. A lot more than 3% of Americans need health care help. Please abandon ultra-conservative distortions and lies regarding tort law and taxes by irresponsible companies and people too cheap to pay their fair tax share and who have no real concern for public health. This is my comment, please. More tax cuts are regressive and will push the tax burden down again and make the deficit worse and destroy government. Taxes should pay for community needs. I've heard some people in this audience say no, they shouldn't. Government folks used to say it. Please support real national health care, also called universal single payer. And it is really better and cheaper. Right-wing opponents lie. They have prices are high due to greed. Insurance companies only profit from government subsidies. This is a comment, you idiots. After they have helped bankrupt governments, with no concern at all for American health care. Reverse Reaganomics tax cuts. By the way, productivity is taxpayer-funded research.
You have to let them know.
I still
It's important for people to know that 40% of Americans pay no federal income tax today. 1% of Americans pay 40% of all taxes. 5% of Americans pay fully 60% of all taxes. If President Obama's measures go forward, over 50% of Americans will be relieved of any federal tax liability burden. My opinion is that taxes need to be fair and they need to be shared. And when you have the federal government offering benefits to all and not asking for contribution for all, that's when you get dramatic distortion. So I think it's important that we take a look at our tax structure, and as we need to have reform in healthcare, we desperately need to have reform in taxation and our tax code. It needs to be scrapped and simplified.
My name is Jeff Lang. I live in the north end of Blaine. I have my 13-year-old grandson here with me, and I have a problem with is he someday going to be able to afford health care if a lot of the small employers cannot afford to give it as part of their pay package? And also, I'm wondering if you, Congresswoman, are listening to the people on the 6th District about a public pay option, for the simple fact that you've taken so many campaign contributions from the lobbyists of the healthcare industry.
And I don't support the government takeover of health care. I don't think that that's the way to go, and I'm very happy to make that case because I am very concerned about your grandson being able to have a job in the future. Right now, under the current bill, 3,200, there's an 8% payroll tax that's imposed upon small businesses. Many small businesses don't have an 8% margin of profit. So even under President Obama's own figures by his own economic advisor, Christina Romer, they say that there will be 5.5 million jobs lost if this bill passes. Those are his figures, not mine. So we're looking at tremendous job loss. We saw 2 million jobs lost after the stimulus package passed earlier this year. If the climate change bill passes, the estimate is that we will lose 2.5 million jobs every year that's in effect. If we put into effect this particular health care bill, that's another 5.5 million job losses. That's not good for anyone, because this bill is all about tax increases. One thing Americans do not need right now are tax increases. We need to
If I could just add.
I'm sorry.
The good news for you is that the Democrats own Washington right now. So it's an internal argument in the Democratic Party as to whether or not they have a public option. Michelle and I are probably not going to vote for it, but you've got 256 guys on the House side. It takes 218 to pass any bill. So it's theirs to either do or not do.
Hello, Michelle. It's Tom Bailey of Stillwater. I'm here with my dad, who's 78, he's slightly handicapped. I have a request for you. My father in the 1950s authored one of the first major medical insurance programs in the country, and he's watched and been involved in an insurance law service and involved model regulations that help with moving the insurance industry to interstate commerce. But he asked that he has an opportunity to speak with you sometime after this forum. He's on Medicaid and Medicare and the prescription drug package, and he's not real happy with where we've headed in this country with our costs. My question is, I'm a father of 7 children. I have 3 sons in the military and veterans. My 6th oldest son, born in 1987, was born with centiplegia. He was under 2 pounds. We nicknamed him Rolls Royce because at the time we fortunately had major insurance coverage, but he was in the hospital for 6 months in intensive care and 6 months at home with full-time nursing care on oxygen, and the cost went over probably $250,000. Today, that would probably go well over $1 million, and my current policy has a lifetime cap of $1 million, and I've heard of a lot of horror stories in this country where people have been devastated with full coverage with bills of as much as $2 million. What is the program that is being proposed to try and cover those catastrophic situations?
Tom, thank you. That is a very real issue that a lot of families face that we have to have answers for. And about, is it 34 states in the country, I believe, have high-risk pools, of which Minnesota is one of those states. That's what I'm talking about. We have to have a safety net where no person, unless you're perhaps Bill Gates, no person could take care of those medical bills. We understand that, and again, I believe that with prosperity, we can have enough money in the system that we can take care of those situations. And I think that Dr. Burgess probably wants to add on high-risk pool. We need to make sure, the problem with the states, they haven't had enough money to be able to deal with the high-risk pool. That's something where we at the federal government level can be a part of that solution. We can be a part of that to help fund for people that are in the situation you and your wife faced with your son. That is the level of compassion that we need to demonstrate. And yes, I'd be honored to meet with your 78-year-old father. I have my 78-year-old mother sitting over here, and my 85-year-old stepfather who served in the Army, and would they stand up right now so we can acknowledge them?
Okay, the young lady on my right.
You know, Dr. Burgess, did you want to...
There is a lot we could do as far as insurance regulatory reform that we're not doing right now. That's the real opportunity we're missing right now. And that's what the American people want to see us work on. These are real deliverables that we could have done before we came home for August.
And that's bipartisan, by the way. That's bipartisan.
And we didn't do it. And that's really the shame of where we've gone with this as far as the structure of the bill has been before us.
Hello, my name is Anne Marie Metzger. I live in Woodbury. I just wanted to make one point to another speaker who was up before me and said that, you know, she had knee surgery and her heel spur, some whatever, had that fixed. Well, my insurance company turned me down for mine. Okay, I'll start there. I'd like to quote Dr. Burgess here. No one can defend, and I certainly cannot defend, the practice of canceling coverage after the fact. There is no acceptable minimum to denying coverage after the fact. You said this during a House Energy and Commerce Subcommittee meeting and hearing. In this hearing, there were policyholders who talked about their coverage being dropped after they were diagnosed with breast cancer, lymphoma, and many other conditions. So my question is, based on your support of your own proposals, your own resolution, Healthcare Freedom of Choice Act, and the other things you've been saying today, how can you propose to send tax dollars to insurance companies who will drop me the minute I get sick, deny me state-of-the-art coverage? And I have shopped around. I have private insurance. And I pay what I pay, I get what I get, and it ain't that great. I had to go, I'm sure a lot of people in this room can tell us horror stories with their insurance company. But my question is, how can you take tax dollars and give it to these thieves? Because people have lived the horror that you're living, where they thought they had coverage, and then they get the door slammed in their face, and they say, where do I go now? And I don't defend insurance companies that have made those decisions, and that's why I want to make sure that tax dollars aren't going to the insurance companies, that you're able to purchase your own health care coverage in a free market. Because let's face it, we don't have a free market right now. What we have is a partial monopoly. Wait a minute, how does somebody go shopping for an insurance policy and say, oh, I might have a heel spurt, let me check on that. Oh, I might come down with something else. Maybe they'll cancel it for that.
Let me explain.
Well, how do you do that?
Sure.
How do you shop around?
Sure.
Tell me how you do that.
Sure. Let me explain how you do that.
I can't predict the future. Huh?
Right. That's right. No one can predict the future, which is exactly why we buy health insurance. We don't know what is going to come down the road.
Exactly.
But if we have a system whereby we allow you to put your money aside in a tax-free account, and we allow total competition, which we don't have now. Here in Minnesota, we have a highly regulated insurance market that is, in effect, a partial monopoly. Insurance is very expensive in Minnesota. If we would erase those state lines that I talked about, and you could purchase any insurance plan you want across the country, where we have true competition, you could purchase the level of coverage you want, because contract law is your friend. If you can buy insurance across state lines. If you purchase health care coverage, and your insurance company slams the door on you and says no, and you purchase a level of care that covers that, you have an actionable claim against your insurance company. They have to pay.
And they have lawyers that they can pay lawyers a lot more than I can.
That's where you need to have the ability to be able to...
You want to get rid of, and you want tort reform, you want to get rid of malpractice.
You need...
Nice.
What you need to have is the ability to
be able to purchase the level of coverage that you need to. And I think there's no dispute that tort reform has dramatically increased the price of health care for everyone. So we want to be able to bring that in line and under control, because I want to make sure that doesn't happen to you or anyone else.
Okay.
Thank you, Anne Marie.
Now we are at 4:15. I would like to have closing remarks by Congresswoman Bachmann. Hey, come on.
4:15. Why don't we take, if we go quickly, let's try and take 2 more questions. We have to wind it up because of other commitments that we have. We were happy we could extend it 15 minutes. We'll extend it at least another 5. We'll try and do these 2 questions pretty quickly. We'll have very brief closing remarks, and then we'll go from there. Thank you. Go ahead.
Okay. Hi, I'm Joe Vaccaro. I call Woodbury, Minnesota home. And I was just wondering that since you've emerged as kind of the standard bearer of the faith-based style of governance the Republican Party has been promoting since about 1980, how do your religious views play into your positions on the healthcare thing? I know you cite religion in your positions on abortion and gay marriage and other issues. And I mean, I'm sure a lot of people vote for you because you are a faith-based candidate. And I'd like to hear your position on the issue based on your faith.
Okay, the question was, what is my position on health care based on my faith? As a member of Congress, my position on health care is based on the concept of freedom. Freedom is fundamental to most religious faiths, and that's
Okay, last question.
All right, good afternoon. My name is Paul Mueller, and I'm a resident of Ham Lake. And I would like to extend my sincere thank you to all of you, the panel, for having this conversation this afternoon, without question. I would like to drop this brief piece, though. It would have been wonderful, it would have been bipartisan. How much more valid that would have been, maybe something for the future. But I would like to say, this shouldn't be about winners and losers. And right now, we have people losing out. Roughly 50 million Americans do not have access to health care. Touched on that. Finish my point. Thank you very much. Affordable, quality, accessible health care. You know, I'm a classroom teacher, have been for 25 years. Kids come into the classroom, they don't have health insurance. Kids who are sick can't learn. Wellness equals productivity, citizens and kids. It's a good thing. I support the public option because of the opportunities that it provides for competition. Now, here's my question. Senator David Bernberger was on the radio last week at public radio, and he brought up a point. He said, you know, in 1991, that health reform effort got torpedoed. And it got torpedoed because of politics, not policy and substance. He said that point blank, and I think he's absolutely right. What are we going to do to make sure, what are you folks going to do to make sure that this does not get torpedoed because of politics and we're ignoring the substance? What are we going to do to keep politics out of this?
Well, number one, we're in the political realm, and so politics inevitably seems to be a part of it. I don't want to see government take over a curve. So I don't think that that's going to be a positive solution for us going forward. One thing I would like to talk about are the 47 million without insurance. What we need to recognize is we need to take that number apart, because it isn't 47 million people, and again, in that 47 million number, this is what the President's proposing. That if we bring those 47 million people under the taxpayer paying their way on health care, that will actually cut the costs for government, and we won't have to cut anyone else's health care options. That just defies logic and common sense. It's not going to happen. So we need to look at that reality. We also need to look at who we're talking about. It actually, when you take that 47 million figure apart, you're talking about people that are making in excess of a certain cohort, or people making over $75,000 a year who aren't buying health insurance just because they don't want to. Then you have about 20% that are illegal aliens that we don't necessarily a large cohort of people that are between the ages of 18 and 34 who maybe are making $50,000 or maybe something in that neighborhood, they just don't want to buy health care. You get down to actually the chronically uninsured, and this number doesn't stay static. Most people are uninsured about 18 months. Maybe 8 million people at most. we can do something with tax credits and other options in the marketplace, or vouchers for very difficult places, or high-risk schools. There are things that we can do to solve those really tough cases. But let's not destroy health care for another 130 million people.
With that, again, I'd like to thank the school district for...
Can Dr. Burgess...
Yes, I'm sorry.
I just want to address the gentleman. I'll even let this be my closing remarks. I mean, you asked about the question of bipartisanship, and as I said before, really, the Democrats do own Washington right now. They can do whatever they want. They don't need Michele and I. It's their deal. Now, where was I on Monday? I was down in McAllen, Texas. Two Democratic congressmen asked me to be down there and talk to their county medical society because they're having a big problem because some of the adverse publicity they have gotten about an article that was written in the New Yorker. So I was happy to do that, happy to be a part of it. We don't agree on everything, but there are things on which we do agree. During the fall, I met with Bill Shalero, who was the transition team member for the incoming Obama administration. I said, look, I didn't give up 25-year practice to be on sidelines when this stuff is done. Let me be a resource to you. We're not going to agree on a lot of stuff, but there may be places we agree. I went to Henry Waxman, my chairman of my committee. I said, didn't give up a 25-year career to sit on the sidelines. I'll be happy to work with you where we can, and where we can, we can. He thanked me very much for showing up. Closed the door. It's the last I ever saw. I got invited down to the White House for a photo op in March, and that's been it. That's been it. So this has not been, there has not been the open invitation. If you want me to be part of this bill, put tort reform on the table and say, okay, doctor, you got to take mandates, you got to take a public option, so we get to tort reform. I might have been there. All I know is my vote was no, but they never even tried. They never even tried to bring me along and bring me in and say, what is it going to take for you to bring some Republicans with you so we can have a true bipartisan effort? They weren't interested in it. And true enough, they won the election. They kept telling us that. They don't need us. They don't want us. Fine. But it does make it difficult when you hear about the real problems we've heard about today. And the lady who quoted me is exactly right. I would not defend those insurance companies that did that. We had it within our power to change the regulations so that they can't do that anymore. What do they want in return? They want a mandate. I'll tell you what, they don't deserve a mandate. They want you to be able to have to buy insurance from them in order to work for them to change their business practice. I'll say, no, you need to change your business practice, and then we'll find out if we've got something to talk about.
We will now go on to closing remarks.
I want to thank everyone again today, especially those in the cafeteria who labored by looking at a video screen and an audio screen. Thank you for your willingness to come out on this beautiful day. Thank everyone who's here. We thank Oakland Junior High. The debate is not over. It's only just begun. And thank you for engaging in what the founders worked so hard to give us, and that's a free society. So let's make sure we keep it. Thank you again.